Hi, my name is Vanessa Baker. I'm a nurse practitioner student here with Youngstown State University, and today we are going to assess your cranial nerves and your muscles, your joints, and your reflexes. So, starting off, can I get your name and date of birth?
Zach Baker, 10/15/90.
Okay, so starting off with your cranial nerves, going with cranial nerve number 1, which is your olfactory. So I'm going to have you close your eyes, occlude one nostril, and then I'm going to have you identify a scent from each nostril.
Alright.
So go ahead and close one nostril, and then scent number 1.
Coconut.
Okay. Now go ahead and include the other nostril, and scent number 2.
Cinnamon.
Okay, good. So now moving on to cranial nerve number 2, which is optic. So I'm going to have you cover one of your eyes, and I'm just going to show numbers in each field and have you identify them.
Alright.
So closing your right eye.
2, 1, 2,
Okay, so now moving to your left eye.
3, 4, 1.
Okay, good. Moving on with the optic nerves, 3, 4, and 6. First, I'm just going to check that your pupils, I see that they are both round, about 3 millimeters in size. I'm now just going to check to make sure that they are reactive to light. So just go ahead and stare straight ahead. Okay, and see that that pupil reacts. Okay, good. Seeing that both pupils constrict to the light. So moving on, I'm just going to do accommodation. So I'm going to have you stare at the tip of this pen, and I'm just going to bring it in. Seeing that, okay, your pupils accommodate to the object. So now moving on, I'm just going to do the 6 cardinal fields of gaze. So I'm going to have you follow the tip of my pen throughout each field, noting that there is no nystagmus noted, which there is none. So good. Those are all good. So moving on to cranial nerve number 5, your trigeminal. First, we're just going to do the motor part of it. I'm going to have you just bite down, okay, and then now try and open. Okay, good. So now sensory, I'm just going to have you close your eyes, and in each field, I'm going to have you identify if it is sharp or dull that you feel. So starting.
Sharp.
Okay.
Dull.
Okay.
Sharp.
Okay. Now moving on to the other side, go ahead and keep your eyes closed.
Sharp.
Okay.
Dull. Dull.
Good. Alright, so that is good. So then now moving on to cranial nerve number 7, which is facial. I'm just going to have you go ahead and close your eyes really tight, and then now open them really wide, and then now smile, and then now frown. Okay, good. Moving on to cranial nerve number 8, which is the acoustic. I'll just do the whisper test here. So I'm just going to have you close your eyes and repeat the word that I say. Baseball.
Baseball.
Okay, and then I'm moving to this side. Cat.
Cat.
Okay, good. Already in the previous video, I did the Weber and Rhine test, and you did good on that. So that is cranial nerve number 8. And then cranial nerve number 9, which is your glossopharyngeal. I'm just going to have you open up and say ah, and I'm just going to make sure that your uvula moves up, and it does. Here's where I would test for a gag reflex, but we're going to pass that. So then moving on, cranial nerve number 10, which is your vagus nerve. I'm just going to have you say a sentence and then swallow. So I'll just ask, how are you doing?
Pretty good.
And then now swallow. Okay, perfect. And then cranial nerve number 11, which is your spinal. I'm just going to have you move your head side to side, but I'm going to have you push against. So move your head, and then now push. Okay, next side, now turn. Okay, good. And then I'm going to have you shrug your shoulders, but kind of push up against my resistance. Okay, good. And then cranial nerve number 12, the last one, which is your hypoglossal. I'm just going to have you stick your tongue out, now move it side to side, and then I'll put it back in your mouth. Okay, good. So all your cranial nerves were well and intact. So then next we're just going to assess your cerebellar function. So starting off with coordination and fine motor, I'm gonna have you put your finger on your nose, and then I'm gonna have you touch my finger and then go back to your nose. So, and one more. Good, okay. So then balance, I'm just going to have you stand straight up. You're going to cross your arms and close your eyes for a couple seconds, making sure that I see no swaying. Good, okay. Then while you're standing, I'm just gonna have you do your gait. So taking a couple steps heel to toe, just go ahead so I can assess your gait and seeing that your posture is good as well. Okay, good. You can go ahead and sit back down. So next we're gonna move on to sensory. I'm going to have you tell me at what location of your body and if it is sharp or dull that I am touching you with. So go ahead and close your eyes. Go ahead and tell me what you feel and where.
Left arm and sharp.
Okay. Keeping your eyes closed. Tell me where.
Right side of my neck and dull.
Okay. Still keeping the eyes closed.
Right thigh and sharp.
Okay. And then one more.
Left foot and dull.
Okay. So that is good. All right. So then now doing your perception, I'm going to have you close your eyes and then now holding your hand out, lift your fingers up. Okay. And then now lift them down. Okay. So then now doing that with your feet. So you can put your hands down. Let's go ahead and lift your toes up and then down. Good. So perception is good. All right, so then now I'm going to have you just identify objects with your eyes closed. So go ahead, hold your hand out. Okay, so then tell me what this object is.
Lotion or soap.
Okay, yep. And then now the right hand.
A ring.
Yeah. Good. Okay. So then moving on, I'm going to have do the discrimination. So I want you to tell me if you feel 1 point or 2 points touching you. So closing the eyes.
2.
Yep.
2.
1.
1.
Yep. Now again.
1.
2. And
1.
yeah. Good. Okay. So moving on, I'm just going to have you identify what letter and number I am going to draw in your palm while your eyes are closed. So holding out, so what letter?
L.
Yep. Okay, and now in the right palm, what number?
3.
Yeah, good. Okay. So then next, just going to move on to your reflexes, doing the deep tendon reflexes. So going to start with your bicep on the left arm. So feeling here for the tendon, okay, and now, okay, so that reflex is present. And then now going over here. Okay, good. That was actually the brachial radius tendon. So now I'm going to do the bicep, feeling up here. Okay, good. And then now the bicep on this arm, so you can see. Okay, good. So those tendons, those reflexes are intact. So then now we're going to move to the tricep, the patellar tendon, going to the knee here. All right, so, okay, and then this one. Okay, so then now moving to the Achilles, moving down here, present. So those are all intact and +2. So now I'm just going to test your plantar reflex. So I'm going to see each foot here and see. Okay, so there's nothing there. So that's negative Babinski, and then negative Babinski as well. Okay, so then real quick, I'm just going to do assess for an ankle clonius. So I'm going to see each foot here and just relax. And I'm going to move real quick and then hold. Okay, and then noting no clonius, and then this one. Okay, noting no clonius as well. So that is good. So moving on to your muscle skeletal assessment. First starting off, feeling and inspecting your shoulders, your joints. I feel no crepitus, feel no masses. No tenderness is noted when these are palpated.
Nope.
No. Okay. Moving on to the elbows. Once again, feeling no crepitus or masses, no redness, no crepitus or masses, no redness is noted in the skin, no bruising, no tenderness there.
Nope.
Okay. The wrist, no crepitus or masses, no redness, no crepitus, masses, or redness, no tenderness in the wrist.
Nope.
Okay. The knees, no crepitus or masses, and then no crepitus or masses, and then no tenderness in the knees.
Nope.
Okay. And then the ankles here, no crepitus or masses is noted, and no crepitus masses are noted, and then no tenderness.
Nope.
Okay. So palpation, nothing abnormal. Your skin, everything's symmetrical. I note no atrophy with any of your muscles. All your muscles are appropriate in size and shape, and they're symmetrical. So moving on, going to test your range of motion. So starting with your fingers, go ahead and flex them up, and then now flex them down. Okay. And then your wrists, go ahead, flex, and then now flex down. Okay, good. And then now we'll do your elbows, so kind of holding them out. So flex up, and then extend. Okay, and then now do that arm. Okay, good. And then now, so doing your shoulders. So go ahead and put one arm up, and then back behind. Okay, and then now the other arm up, and the other arm behind. Okay, and then now real quickly just do abduction, and then add. Okay, and then the other arm, abduction, and add. Good. Okay, so range of motion was appropriate there. So now we're going to just do your jaw. So go ahead and open and close. Okay, and then now side to side. Okay, good. Range of motion done there. Noting no abnormal movements, no pain while performing those, right?
Nope.
Okay. So moving on, your cervical spine, just going to have you put your chin to chest, and then now bend it back, looking up. Okay, and then now twist side to side. Okay, noting nothing abnormal there. And then I'm going to have you go ahead and stand up, and I'm going to have you face that way and bend to touch your toes. Okay, noting that there is no curvature in your spine, and your hips are symmetrical as well. Okay, so then now go ahead and just like bend back. Okay, good. Noting nothing abnormal there. And now we will do the hips. Okay, so now doing the range of motion of your hips. If you could go ahead and lift your left leg all the way up. Okay, so then now go ahead and adduct it. Good. So then now do the same for the right leg, lift it up, and then adduct it. Good. Okay, so then now doing the knees, go ahead and bring your left leg all the way up to see the extension, And then now bend it to 90 degree, seeing the flexion, good. And then now go ahead for the right leg, seeing the extension, and then now flexion, good. So then now going to the ankles, go ahead and flex the left ankle all the way up, okay, and then now flex the left ankle down, okay. Now do the right one, flexing it up, and then flex it down, okay, good. All right, thank you.
Thank you.